Reproductive health, problems and strategies, population explosion and birth control, medical termination of pregnancy, sexually transmitted diseases, infertility. And these are the topics which we are going to discuss now. You have learned about human reproductive system and its functions in chapter 3. Now, let us discuss a closely related topic, reproductive health. What do we understand by this term? The term simply refers to healthy reproductive organs with normal function. However, it has a broader perspective and includes the emotional and social aspects of reproduction also. According to the World Health Organization, WHO, reproductive health means a total well-being in all aspects of reproduction: physical, emotional, behavioral, and social. Therefore, a society with people having physically and functionally normal reproductive organs and normal emotional and behavioral interactions among them in all sex-related aspects might be called reproductive health. Why is it significant to maintain reproductive health, and what are the methods to be taken up to achieve it? Let us examine them. Reproductive health problems and strategies. India was amongst the first countries in the world to initiate action plans and programs at the national level to attain total reproductive health as the social goal. Total reproductive health. This program, called family planning, were initiated in 1951 and were periodically. What happened?
Keep a saliva to yourself.
Wait. What chocolate that is?
Some chocolate. I don't know, because under my desk.
Family planning were initiated in 1951 and were periodically accessed over the past decades. Improved programs covering wider reproduction-related areas are currently in operation under the popular name.
Go wash your face.
Can you just
Use the towel to wipe.
That's better. Related areas are currently in operation under the popular name Reproductive and Healthcare, Child Healthcare, Reproductive and Child Healthcare programs. Creating awareness among people about various reproduction-related aspects and providing facilities and support for building up a reproductively healthy society are the major tasks under this program. With the help of audiovisual and print media, governmental and non-governmental agencies have taken various steps to create awareness among the people about reproduction-related aspects. Parents, other close relatives, teachers, and friends also have a major role in the dissemination of the above information. Introduction of sex education in school should also be encouraged to provide right information to the young so as to discourage children from believing in myths and having misconception about sex-related aspects. Proper information about reproductive organs, adolescence, and related changes, safe and hygienical sexual practices, sexually transmitted diseases, STD, AIDS, etc., should help people, especially those in the adolescent age group, to lead a reproductively healthy life. Educating people, especially fertile couples and those in marriageable age group, about available birth control options, care of pregnant mothers, post-natural care of the mother and child, importance of breastfeeding, equal opportunities for the male and the female child, etc., would address the importance of bringing up socially conscious, healthy family of desired size, awareness of problems due to uncontrolled population growth, social evil like sex abuse and sex related crimes, etc. needs to be etc. need to be created to enable people to think and take up necessary steps to prevent them, and thereby build up a socially responsible and healthy society. A lot of people, when we speak about the sex education or something, they think that is something which is not good, which should not be done or something. But the reality is, 1 minute, she is coming with coffee. Thank you. Mm. Successful implementation of various action plans to attain reproductive health requires strong infrastructural facilities, professional expertise, and material support. These are essential to provide medical assistance and care to people in reproduction related problems like pregnancy, delivery, STD, abortions, contraception, menstrual problems, infertility, etc. Implementation of better techniques and new strategies from time to time are also required to provide more efficient care and assistance to people. Statutory ban on amniocentesis for sex determination to legally check increasing menace of female fetuses. That's what you told, na? A village near. Massive child immunization, etc., are some programs that merit mention of this connection. In amniocentesis, some of the amniotic fluid of developing fetus is taken to analyze the fetal cells and dissolved substance. This procedure is used to test the presence of certain genetic disorders such as Down syndrome, hemophilia, sickle cell anemia, etc., determine the survivability of the fetus. Research of various reproduction related areas are encouraged and supported by governmental and non-governmental agencies to find out new methods and to improve upon the existing ones. Do you know that Sale, a new oral contraceptive for females, was developed by scientists at Central Drug Research Institute, CDIR, Central Drug Research Institute, CDIR, Lucknow in India. Better awareness about sex-related matters, increased number of medically assisted deliveries, and better postnatal care leading to decreased maternal and infant mortality rates, increased number of couples with small families, better detection and cure of STDs, and overall increased medical facilities for all sex-related problems, etc., all indicate improved reproductive health of the society. Postnatal care, infant mortality rate, better detection and cure of STDs, increased medical facilities. Population stabilization and birth control. In the last century, an all-round development in various fields significantly improved the quality of life of people. However, increased health facilities along with better living conditions had an explosive impact on the growth of population. The world population, which was around 2 billion, 2000 million in 1900, rocketed to 6 billion by 2000 and 7.2 billion in 2011. A similar trend was observed in India too. Our population, which was approximately 350 million at the time of our independence, reached close to billion mark by 2000 and crossed 1.2 billion in May 2011. A rapid decline in death rate, maternal mortality rate MMR, and infant mortality rate IMR as well as an increase in number of people in reproducible age are probable reason for this. Through our reproductive child health RCH program, though we could bring down the population growth rate, it was only marginal. According to 2011 census report, the population growth rate was less than 2%, that is 20,000 years. Okay, 2% for 20 or 1,000 years, a rate at which our population would increase rapidly. Such an alarming growth rate would lead to an absolute scarcity of even the basic requirement: food, shelter, and clothing. In spite of significant progress made in those areas, therefore, the government was supposed to take up serious measures to check this population growth rate. The most important step to overcome this problem is to motivate smaller families by using various contraceptive methods. You might have seen advertisement in the media as well as poster bills showing a happy couple with 2 children with slogan "Hum do, hamare do."
हम दो हमारे दो.
Hum do, hamare do. We too are two. Many couples, mostly the young, urban, working ones, have even adopted an one-child norm. Statutory rising of marriageable age of the female to 18 years and that of males to 21 years, and incentives given to couples with small families are two of the other measures taken to tackle this problem. Let us describe some of the commonly used contraceptive methods which help prevent unwanted pregnancy. An ideal contraceptive should be user-friendly, easily available, effective, and reversible with no or least side effects. It also should be in no way interfere with the sexual drive, desire, or the sexual act of the user. A wide range of contraceptive methods are presently available, which should be broadly grouped into following categories, namely natural, traditional, barrier, IUDs, oral contraceptive, injectables, implants, surgical method. Implants, surgical methods. Which method would be best, ma? Natural or natural methods work on a principle of avoiding chances of ovum and sperms meeting. Periodic absentence is one of such methods in which the couples avoid or abstain from coitus from 10 to 17 of the menstrual cycle when ovulation would be expected. As chances of fertilization are very high during this period, it is called the fertile period, 10 to 17, especially 13, 14, 15. Okay. Therefore, by abstaining from coitus during this period, conception would be prevented. Withdrawal of coitus interrupts is another method in which the male partner withdraws his penis from the vagina just before the ejaculation, so as to avoid insemination. Lactational amenorrhea, absence of menstruation method is based on the fact that ovulation, and therefore the cycle do not occur during the period of intense lactation following parturition. Therefore, as long as the mother breastfeeds the child fully, chances of conception are almost nil. However, this method has been reported to be effective only up to maximum period of 6 months following parturition. As no medicines or devices are used in these methods, side effects are almost nil. Chances of failure of this method are also high. Lactational amenorrhea. Okay. That is, while you are lactating, you are breastfeeding the child, automatically the chance of conception is less. Conceiving is less, and automatically it is also a good barrier. But its chance is only good for up to 6 months. In barrier method, ovum and sperm are prevented from physically meeting with the help of barriers. Such methods are available for both males and females. Condoms are barriers made of thin rubber latex sheet that are used to cover the penis in the male or vagina and cervix in the female just before the coitus, so that the ejaculated semen would not enter into female reproductive tract. When I was taking this class elsewhere, I took a condom to show that child.
Why, sir?
Hmm?
Why, sir?
Because they have to know what
No,
it is.
I don't want to know.
A barrier is made of rubber latex sheet that are used to cover the penis in the male or vagina and cervix in the female just before coitus, so that the ejaculated semen would not enter into the female reproductive tract. This can prevent conception. Nirud is a formula brand of condom for the male. Use of condoms has increased in recent years due to the additional benefit of protecting the user from contracting STIs and AIDS. Both the male and female condoms are disposable, can be self-inserted, and thereby gives privacy to the user. Diaphragms, cervical caps, and wallets are also barrier methods of rubber that are inserted into the female reproductive tract to cover the cervix during the coitus that prevent conception by blocking the entry of sperms through the cervix. They are reusable. Spermicidal creams, jellies, and foams are usually used along with these barriers to increase their contraceptive efficiency. Another effective and popular method to use intrauterine device, intrauterine device, IUDs. These devices are inserted by doctors or expert nurses in the uterus through vagina. These intrauterine devices are presently available as a non-medicated IUDs. Lippies loop, copper releasing IUDs, CUT and CU7, multi-load 375, and a hormone releasing IUDs, progesterone and LNG20. IUDs increase phagocytosis of sperms within the uterus, and Cu ions released suppresses sperm motility and the fertilizing capacity of the sperm. The hormone releasing IUDs, in addition, make the uterus unsuitable for implantation and the cervix hostile to the sperms. IUDs are ideal contraceptives for the females who want to delay pregnancy and space children. It is one of the most widely accepted method of contraception in India. Okay, IUDs. Nowadays in government hospitals, they perform this IUDs so that the next pregnancy can be delayed to up to 4 to 5 years. Oral administration of small doses of either progesterone or progesterone, estrogen. Estrogen combination is another contraceptive method used by the females. They are used in the form of tablets and hence are popularly called as pills. Pills have to be taken daily for a period of 21 days, starting preferably within the first 5 days of menstrual cycle. After a gap of 7 days, during which menstruation occurs, it has to be repeated in the same pattern till the female desires to prevent conception. They inhibit ovulation and implantation as well as alter the quality of cervical mucus to prevent retard entry of sperms. Pills are very effective with lesser side effects and are well accepted by the females. Sale, Sale then is it? What's the Sale? Is that Hindi word then is it?
Sahila.
Sahil.
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 Sahil. Sahil, the new oral contraceptive for the females, contains a non-steroidal preparation. It is once a week pill with very few side effects and high contraceptive value. Progesterone, along or in combination with estrogen, can also be used by females as injections or implants under the skin. Their mode of action is similar to that of pills, and their effective period are much longer. Administration of progesterone or progesterone estrogen combination or IUDs within 72 hours of coitus have been found to be very effective as emergency contraceptives, as they are used to avoid possible pregnancy due to rape, casually unprotected intercourse. Surgical methods are called sterilization, are generally advised for the male or female partner as a terminal method to prevent any more pregnancy. Surgical intervention blocks gamete transport and thereby prevent conception. Sterilization procedure in the male is called vasectomy and in the female is called tubectomy. In vasectomy, a small part of the vas deferens is removed or tied up through a small incision on the scrotum, whereas in tubectomy, a small part of fallopian tube is removed or tied up through a small incision in the abdomen or through vagina. These techniques are highly effective, but the reversibility is very poor. In vasectomy, if they cut the vas deferens, it will automatically not transfer, isn't it? But in some cases, they will put a knot in it, right?
So again, they can stitch it back.
Not stitching it back. See here, this is vas deferens. It can be knotted here. Automatically, it can't proceed, isn't it?
So they just have to take out the knot.
Take the knot, and if they want to want it back, automatically they can remove the knot and proceed. Okay. Totally cutting, that's it. Okay, it
You
will not
cannot
happen
join.
at all. Yeah. See here, totally cutting this. If you put a knot, automatically it will be fine. But you can't connect this back if you're cutting. Here too, they would have been cutting it completely. All right.
Somebody forgot the key. Yeah, they are kept the milk and forgot.
Vasectomy and tubectomy are effective, but its reversibility is poor. It needs to be emphasized that the selection of a suitable contraceptive method and its use should always be undertaken in consultation with qualified medical professional. One must also remember that contraceptives are not regular requirement for the maintenance of reproductive health. In fact, they are practiced against a natural reproductive event, that is conception, pregnancy. One is forced to use these methods either to prevent pregnancy or to delay or space pregnancy due to personal reasons. No doubt, the widespread use of these methods have a significant role in checking uncontrolled growth of population. However, there are possible ill effects like nausea, abdominal pain, breakthrough bleeding, irregular menstrual bleeding, or even breast cancer, though not very significant, should not be totally ignored. This and all can happen. medical termination or pregnancy, MTP.
You'll be here only. No?
I'm thinking about it. How it will be.
Everything is ready.
You went and got ready. Okay, sir.
No, everything is ready.
All right.
Yesterday itself we made it ready.
Okay, thank you. Thank you. I'll be.
Yeah. What your dress or something? Or
Yeah.
do you want?
I have it. I have it. Yeah.
Chapter is going on now.
We are
Last, huh?
halfway
This is fourth.
halfway into third
Biology.
chapter today. Out of 4 chapters, we are halfway into the 3rd chapter.
And this is
Oh,
the
okay.
last chapter.
Oh, third will be over.
Yeah,
No, this is fourth chapter.
that is the first chapter is being omitted. Second,
Cancel.
third, fourth, and fifth is the chapters which we have to work. We have
Out of
completed
that?
2, 3, and 4th. We are going to complete.
We are in progress.
So one more. is-
One more step. When you complete that, it will be almost.
Ah.
complete.
Actually, we are almost done.
Next chapter, you already
The
know
senior
something.
things.
Already know.
She already knows. Maybe you. Can
Yeah.
ask
The
you
only
guys.
part that I don't know is it's from here.
Okay,
Independent assessment.
This and all I can do.
this is very simple. We
Very
can
simple,
Be
but-
happy.
From here only.
Ah, nice.
From here only I didn't understand properly.
Chemistry, how many you have? Why you are? Yes, yes,
Then I'll go for this one here now.
కొంచెం వేసి ఆఫ్
One 6 lessons in chemistry. Out of this, we already went through 6 and 7 and 8 to some extent.
Organic chemistry we have gone through.
Yeah, organic chemistry, almost everything is over. Solution electrochemistry and chemical kinetics. But we can't, we have to be careful. We already completed this lesson to the second two, but when we are going through again, she's also listening intensely towards it. Or else we would have directly went through the next one.
Okay, plan it out.
All right.
Biology,
Getting thorough.
chemistry.
Biology, we are going to complete 3 chapters fully.
because that will be
complete.
very less marks,
Mm.
and the teacher of biology is ready to corner her.
Extremely ready.
Extremely ready.
You have to, that we should not say, you have to get marks. in
I'll
it.
I'm almost ready.
Principle of inheritance 2, I want you to write a test and see how good you are. Right? When we went through the second chapter fully, you could see that not even a question is termed as difficult. Everything is answerable in seconds.
Answerable. I just check the
Yeah.
question paper.
After completing a second lesson வந்து ஃபுல்லா கம்ப்ளீட் பண்ணிட்டு செக் பண்றோம் ஒரு கொஸ்டின் கூட வந்து மிஸ் ஆகாம இமிடியேட்டா டக் டக் டக்குன்னு எல்லாமே வந்து answer
It was
பண்ற மாதிரி தான்.
actually easy after knowing the chapter properly.
கான்செப்ட் தெரியணும் மெயினா படிக்கணும்.
Yeah, I just tried her method. She's actually making her own questions. She's not taking from
It doesn't matter,
anywhere.
that's
It
what,
doesn't
if
matter
you
when you are
know-
working on
if
the
you
paper
know-
on the whole lesson, whatever question has been taken,
Yeah,
you
you
can.
can answer. That's all. Simple it is. Okay, you can.
Organic chemistry alone I need to learn from textbook.
Hmm.
Other chapters and all I can learn from a guide.
Okay, let's check on
Because I checked the guide and the questions, they were exact,
it. Exact.
extremely exact.
Let's check. Medical termination of pregnancy.
This was recorded.
Yeah,
Our speech was recorded.
it's okay.
Deleted.
Medical termination of pregnancy. Intentional or voluntary termination of pregnancy before full term is called medical termination of pregnancy, MTP, or induced abortion. Nearly 45 to 50 million MTPs are performed in a year all over the world, which accounts to 1/5 of the total number of conceived pregnancies. Oh my goodness. Whether to accept or legalize MTPs or not is being debated upon in many countries due to emotional, ethical, religious, and social issues involved in it. Government of India legalized MTP in 1971 with some strict conditions to avoid its misuse. Such restrictions are all the more important to check indiscriminate and illegal female feticides, which are reported to be high in India. Why MTP? Obviously, the answer is to get rid of unwanted pregnancy, either due to casual, unprotected intercourse or failure of the contraceptives used during coitus of rapes. MTPs are also essential in certain cases where continuation of pregnancy would be harmful or even fatal, either to the mother or to the fetus or both.
Already had.
Already had.
Where?
The,
She gave
Yeah.
she gave.
make-
And I told she gave.
Hmm.
We finished. That is for you guys. We had with biscuits.
MTs are also essential in certain cases where continuation of pregnancy would be harmful or even fatal, either to mother or to fetus or both. MTCs are considered relatively safe during the first trimester, that is up to 12 weeks of pregnancy. Second trimester abortions are much more riskier. One disturbing trend observed in that majority of MTPs are performed illegally by unqualified quacks, which are not usually unsafe but would be fatal too. This is really disturbing. Another dangerous trend is the misuse of amniocentesis to determine the sex of the unborn child. Frequently, if the fetus is found to be female, it is followed by MTP, which is totally against what is legal. Such practices should be avoided because these are dangerous both for young mother and fetus.
Will they ever understand that without female they are not born? They think female is weak.
Effective counseling on the need to avoid unprotected coitus and the risk factor involved is illegal abortions, as well as providing more healthcare facilities, could reverse the mentioned unhealthy trend. Good. Reverse the mentioned unhealthy trend. There is some fact in it. There is some fact in it, but also now it is. Let him know his own senses. Knocking senses on others is not a good option for us. Infections or disease which are transmitted through sexual intercourse are collectively called sexually transmitted infections, STI, or venereal disease, VD, venereal disease, VD, or reproductive tract infection, RTI, gonorrhea, syphilis, genital herpes, chlamydia, genital warts, trichomoniasis, hepatitis B, and the cause of the most discussed infection in the recent years, HIV, leading to AIDS, are some of the common STIs. Among these, HIV infection is most dangerous and is discussed in detail in Chapter 8. Okay, Chapter 8, HIV, detail. Some of these infections like hepatitis B and HIV can also be transmitted by sharing the injection needles, surgical instruments, etc. with infected person, transmission of blood or from an infected mother to the fetus too. Except for hepatitis B, genital herpes, HIV infections, other diseases are completely curable if detected early and treated properly. Early symptoms of most of these are minor and include itching, fluid discharge, slight pain, swelling, etc. In the genital region, infected females may often be asymptomatic and hence may remain undetected for long. Absence or less significant symptoms in the early stage of infection and the social stigma attached to STIs deter the infected person from going for timely detection and proper treatment. This would lead to complications later, which include pelvic inflammatory diseases, PID, abortions, stillbirths, ectopic pregnancies, infertility, or even cancer of the reproductive tract. Okay, cancer of the reproductive tract. Okay, ST is a major threat to a healthy society. Therefore, prevention or early detection and cure of these diseases are given prime consideration under the reproductive healthcare programs. Though all persons are vulnerable to these infections, their incidences are reported to be very high among persons in the age group of 15 to 24. The age group to which you also belong. Okay, you also belong. There is no reason to panic because prevention is possible. One would be free of these infections by following the simple principles given below. Avoid sex with unknown partners or multiple partners. Always try to use condom during coitus. In case of doubt, one should go to qualified doctor for early detection and get complete treatment if diagnosed with infection. 5.5 Infertility. A discussion on reproductive health is incomplete without a mention of infertility. A large number of couples all over the world, including India, are infertile. They are unable to produce children in spite of unprotected sexual cohabitation. The reason for this could be many physical congenital diseases, drugs, immunological, or even psychological. In India, often the people is blamed for the couple being childless. Female is being blamed for couple being childless. But more often than not, the problem lies in the male partner. Specialized healthcare units, infertility clinics, etc. could help in diagnosis and corrective treatment of some of these disorders and enable these couples to have children. However, where such corrections are not possible, the couples could be assisted to have children through certain special techniques, commonly known as assisted reproductive technologies, ART, assisted reproductive technology. In vitro fertilization, IVF, fertilization outside the body is almost similar condition as that of the body, followed by embryo transfer in one such method. In this method, popularly known as test tube baby program, ova from the wife, donor female, and sperm from the husband, donor male, are collected and are induced to form zygote under stimulated condition in the laboratory. The zygote or early embryo with up to 8 blastomeres would then be transferred into the fallopian tube. Zygote intrafallopian transfer, and embryos with more than 8 blastomeres into the uterus. Intrauterine transfer. To complete its further development, embryos formed in vivo fertilization, fusion of gametes within the female, also could be used for such transfer to assist the females who cannot conceive. Transfer of an ovum collected from a donor into fallopian tube, gamete intrafallopian transfer of another female who cannot produce one, but can provide suitable environment for fertilization and further development in another method attempted. Gamete intrafallopian transfer of another female who cannot produce one, but provide suitable environment for fertilization and further development is another method attempted. Intracytoplasmic sperm injection is another specialized procedure to form an embryo in the laboratory in which a sperm is directly injected into the ovum. Sperm is directly injected into the ovum, directly injected. Infertility cases, either due to inability of the male partner to inseminate the female or due to very slow sperm count in the ejaculates, could be corrected by artificial insemination, AI technique. In this technique, the semen collected either from the husband or a healthy donor is artificially introduced into the vagina or into the uterus. Intrauterine insemination. Though options are many, all these techniques require extremely high precision handling by specialized profession and expensive instrumentation. Therefore, these facilities are presently available only in very few centers in the country. Obviously, their benefits is affordable to only a limited number of people. Emotional, religious, and social factors are also deterrents in the adaptation of these methods. Since the ultimate aim of all this procedure is to have children, in India we have so many orphaned and destitute children who would probably not survive till maturity unless taken care of. Our laws permit legal adoption, and it is as yet one of the best methods for couples looking for parenthood. Adoption, okay, legal adoption.
And my teacher said they totally killed the chapter
Why?
because of this last 2 lines.
Why? What happened?
Here they said about taking two ovary and sperm, fusing them in the lab and all, they're telling all those techniques. But last line they're saying best method for the couple is to adopt.
Yeah.
Yeah, that's what she said. This last 2 lines have killed the chapter itself.
Mhm. So that those people also won't be left alone.
But what
isn't
can
it?
we do? We are stubborn to have some our own bloodline.
Blood is not going to help.
You have to tell them that.
It is
Part,
definitely not going to help.
This part I know, this part I know. Still inheritance of 2 genes I know. Only from law of independent assortment.